Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
When you think about B vitamins, most of us realize that they play a really important role when it comes to supporting our cellular energy levels, when it comes to our metabolism, our cardiovascular system, our cognition, and so many more functions that are crucial for different metabolic pathways every single day in the human body. Today, I want to focus on one specific B vitamin that sometimes is overlooked in terms of its overall importance, and that happens to be vitamin B6. We know vitamin B6 as pyridoxine, and this is incredibly important to so many different functions in our everyday life. So I want to talk about it in some more specific details for you today. So I am Amanda Williams, MD, MPH, and let's get right to it. Let's talk a little bit about pyridoxine and why pyridoxine is such an integral component within our body's everyday functioning. And part of that reason is we know that vitamin B6 is a cofactor, meaning it's required for more than 160 enzyme-driven reactions in the body. And this can affect things from amino acid transformation to the synthesis and the breakdown of different neurotransmitters. When we think about cellular energy production, we think about the immune system, we look at methylation reactions in the body, and certainly when we look at that cellular level of DNA synthesis as well as DNA repair. Now, one of the things that we know about vitamin B6 is that we usually obtain an adequate amount when it comes to our food sources. However, we do recognize that many people are starting to show either insufficient or deficient levels of vitamin B6, which can be incredibly problematic when we think about all of the different health implications to this. Now, some of the foods that we can be exposed to that have B6 in it include certain fish, chicken, for example, things like peanuts, oats, even bananas contain vitamin B6. And for many people, maybe your diet is high enough in these things. Maybe you start your day with some oatmeal and some bananas. But for many others, following that standard American diet can actually lead you down that path to a vitamin B6 insufficiency, or even more severe, lead you down the path to having deficient vitamin B6 levels. And one way that we can look for your vitamin B6 status is actually looking at it in its active form, which is pyridoxal 5-phosphate, often shortened as PLP. Now, we know that we have to have B6 for these 160 different enzyme-driven reactions. It's kind of similar when we think about the role of magnesium. We know that magnesium is required for over 300 different enzymatic processes within the body. And now we're looking at B6, this really important B vitamin, and saying, wow, 160 different things going on in the body are reliant on vitamin B6. And this is important for our heart, for our brain. When we look at homocysteine levels, for example, we know that homocysteine is a indicator for vascular inflammation. And if you have high homocysteine levels, the likelihood that you have inadequate vitamin B6 intake is generally pretty high. So when you see elevated homocysteine, we have to start looking at B6 levels, looking at your B12 levels, as well as your folate levels. All of these things are very important. But there have been so many studies that have linked vitamin B6 insufficiencies and deficiencies to things like depression and anxiety. We can also look at the correlations between low vitamin B6 status in the body and a overall greater risk of dying from different inflammatory conditions. And what are different inflammatory conditions? Well, pretty much every single chronic disease out there has an underlying problem with inflammation, which is why we always say inflammaging. So chronic low-grade inflammation can lead to an accelerated aging process. They have been able to link low vitamin B6 levels to different cancers, colorectal cancer, for example. And we certainly have been able to recognize that vitamin B6 supplementation can be utilized for a variety of different health concerns. I already had mentioned the cardiovascular concern with elevated homocysteine, but we also have seen studies where vitamin B supplementation actually can lower inflammation levels in patients who have rheumatoid arthritis. Yes, I kid you not. Thinking about a simple B vitamin and how that can actually be advantageous for those who are suffering with what can become incredibly debilitating with RA, so rheumatoid arthritis. And in the European Journal of Clinical Nutrition back in 2010, they actually looked at the anti-inflammatory benefits of vitamin B6 supplementation in patients who have RA. And they were giving them 100 milligrams of vitamin B6 for 12 weeks. And they were assessing their different markers, these different parameters to which they were able to determine their level of inflammation. So things like C-reactive protein, looking at their erythrocyte sedimentation rate, looking at their interleukin-6 levels, TNF-alpha, tumor necrosis factor alpha, for example. And they realized that after the 12 weeks, all of these levels had gone down significantly. And they were also able to see that their pyridoxal 5-phosphate serum levels had gone up. So they concluded that 100 milligrams of vitamin B6 supplementation actually suppressed pro-inflammatory cytokines in patients with rheumatoid arthritis. Well, you generally don't see that when you flip on your evening TV shows and you see all of the different commercials that are targeting patients who have rheumatoid arthritis. You don't hear them talk about vitamin B6, for example, but we certainly know just from the science alone that this has been shown to be incredibly advantageous in that setting. We also have seen studies where higher vitamin B6 levels have been associated with lower heart attack risk in women. And in the American Heart Association's journal called Circulation, researchers from Harvard University had found this association between higher B6 levels and a reduction in the risk of dying from a myocardial infarction, which is a heart attack. So this is one of those things where, once again, you generally don't hear your physician talk about, hey, are you getting enough B6? What's your diet like? Does your diet support enough B6 every single day to allow your body to do all of these 160 different enzymatic processes each and every single day? Generally speaking, you're not going to hear your physician talk much about vitamins, but yet we know all of these different things. Certainly we know that when it comes to glycation, and remember, glycation is when we have excess glucose that is going around and it's attaching to things in the body, which can create a whole slew of problems. You think about cataracts, for example. We look at glycation being associated with the development of atherosclerosis and kidney disease. And we certainly see that glycation end products, the advanced glycation end products, have been associated even in the setting of Alzheimer's disease. So glycation creates havoc. We see glycation cause issues in the collagen in our skin, for example. So what are some of the things that can help to offset glycation reactions? Well, we certainly know that benfotiamine that you can find in the Nerve-HX is a primary targeter for glycation. But we also recognize that vitamin B6 also can target these advanced glycation end products and impede that damaging effect of glycation. So there's all of these different things that we can utilize vitamin B6 for, which is why I wanted to talk about it today in more detail, because many times we overlook the role of just one single isolated B vitamin and what it's actually doing. We know that we have to have B6 for tryptophan metabolism. Why is that important? Because tryptophan is that intermediate step when it comes to the manufacturing of our neurotransmitter serotonin. Serotonin helps to support healthy mood. So we know that this is very important, not only for mood, but also for appetite control. So if we do not have adequate B6 in the body, that is going to impede the proper functioning of tryptophan in the manufacturing of your serotonin. We also know that vitamin B6 plays this really incredibly important role when it comes to heart health, when it comes to nerve health, when it comes to the formation of our hemoglobin. And we know that the higher amounts of inflammation that we have in our bodies, the more that those B6 levels can start to go down. Now, recently, there was a study where they looked at the levels of B6 and looking at the correlation with breast cancer. Now, this was published in Cancer Epidemiology and Biomarkers and Prevention Journal, and they were able to link vitamin B6 levels with invasive breast cancer in postmenopausal women. They were looking at over 1,400 women that were involved in this study, and this was done via the University of Hawaii Cancer Center. And they found that lower levels of pyridoxine 5-phosphate were observed in women who had the more aggressive forms of breast cancer. So what does that basically lead us down the path to? Well, once again, recognizing that the lack of dietary intake of vitamin B6, the increased levels of inflammation in the body, can lead to the greater risk of the development of certain cancers, including breast cancer. I had already mentioned colorectal cancer. So we definitely know that there are so many ways that vitamin B6 can really support our overall health. And that is why I wanted to kind of just highlight this little powerful B vitamin for you today. And I want to thank you so much for tuning into the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. And we will see you next time for another episode of the Invite Health podcast.